Hi, I'm James Bennett, and this is case study number 92. An 11-year-old female patient was brought into the emergency room by her mother, complaining of the following symptoms for the past 3 days. The patient had a sore throat, difficulty swallowing, pain when swallowing, a feeling of being cold, fever of 102.3 Fahrenheit, and a poor appetite for the past 48 hours. The patient's medical history states that the patient had a viral-like URI at age 9, chickenpox at age 6, ear infections at ages 3 and 4, and all of the patient's immunizations are up to date. In the patient's social history, it was stated that both the stepfather and the mother of the patient both smoke in the household. The patient is allergic to penicillin. The physical exam revealed the following things. The patient appears ill, pale, and she's shivering despite the fact that she has 2 blankets on. Her heart rate was 104, which is slightly elevated compared to 100 being the higher end of the normal threshold. An oral temperature of 103.1 Fahrenheit. Her skin is very warm to touch. She has tonsillar edema, erythema with yellow or whitish exudate, soft palate erythema, strawberry tongue, several small mobile lymph nodes that are tender when palpated. The lab results came back as being positive for streptococcal antigen. Also, her neutrophils and lymphocyte count were elevated, and the erythrocyte sedimentation rate was also elevated. Based upon the patient's medical history, social history, and lab results, I feel this patient has acute streptococcal pharyngitis. The normal treatment for this type of infection would be penicillin, but since this patient is allergic to penicillin, the drugs of choice would be a cephalosporin, erythromycin, or azithromycin. Acetaminophen or ibuprofen could also be given in conjunction with these antibiotics for symptom relief. This patient is also at a risk of developing rheumatic heart disease. This would be caused by not starting treatment soon enough or stopping treatment too early and allowing the infection to spread to the heart. Rheumatic heart disease is essentially when it reaches the heart, it permanently damages the valves in the heart. Based upon this patient's diagnosis, I feel this patient has a very strong prognosis to start feeling better within 48 to 72 hours and to be completely cured after the antibiotics have run their course in approximately a week to 2 weeks. Thank you and have a great day.